Hi, I'm Rebecca Henderson, representing the American Dental Education Association in my role as the Allied Dental Educators Fellow. Today, I'm excited to provide you an overview and acclimation to the academic dental and allied dental careers world. Whether someone is considering an academic profession or already working in an educational setting, there are particular nuances and jargon to navigate from industry, from clinical practice, and even from institution to institution. This presentation aims to identify types of allied dental and dental education programs for academic careers, to briefly summarize the history of educator shortages in dental and allied dental education, and to acclimate with the jargon and types of positions available in academia. So a little overview of the programs, and these are CODA approved programs within the United States. You see that the dental or predoctoral programs and the number of those within the US, and also the allied dental programs. And allied is a broad term that refers to dental hygiene programs, dental therapy programs, dental assisting programs, and dental laboratory programs, and the general numbers of those programs that are, again, CODA approved programs here in the US. You see the percentage breakdown between the number of public programs and private programs, and we'll expand on those designations in our next slide. So what do these different designations mean? So public are operated publicly by elected officials or appointed school boards or board of trustees, and supported primarily by public funds. Private institutions are controlled by private individuals or non-governmental agencies separate from publicly funded programs and schools, and not typically funded or run by elected or appointed officials. These programs may be for-profit programs or not-for-profit programs. And a nonprofit program is defined as an institution that does not receive compensation other than wages and rent and other expenses for the assumption of the risk of holding that school or running that program. Whereas for-profit programs receive compensation other than those wages and rent and other expenses for the assumption of the risk of educating individuals. And then there are private, which are state-related programs, and they receive a per capita enrollment, a subsidy, or some funding per state resident, a prescribed dollar amount that gets funneled into that academic institution. And then there's federally supported programs such as military programs. So diving into a little bit of the history of faculty shortages, and we'll discuss kind of allied and dental faculty shortages and the trends that have, been happening really over the last 70 years or so that we've been studying and tracking and watching these shortages and kind of trying to anticipate some of the impacts and remedy some of that. And so we'll gain a little bit of understanding of what's been going on with this over the last many years. So when we look at this infographic here, we can see we have the allied programs outlined here with dental assisting, dental hygiene, and dental lab tech. Obviously, dental therapy is very new. There's only a few programs that have opened recently, so we don't have this type of long-term data for the dental therapy programs. And we can see here in the blue, we're looking at total estimated retirements within those types of programs. And then we look at those resulting in a lost position and those resulting in a vacant position, and differing between what is a lost position and what is a vacant position. A lost position would be a position that is not planning to be replaced. When someone leaves or retires, that's a position that is not going to be replaced, so it's considered a lost position or not going to be filled position for that institution. And we can see here that there's quite a high percentage or a high number of projected retirements, especially in the dental hygiene programs, and a moderate amount of those that will result in a lost position. And then another, significant amount, we're looking at 31 positions would be vacant, needing to be filled. And obviously the numbers in dental lab tech are a lot smaller and dental assisting are small, but the trends are very similar in that there's a greater number of retirements you know, expected retirements resulting in positions that are going to need to be replaced or filled. When we pivot over to ages of faculty, we can look at, in blue, we have dental assisting, in orange, we have the dental hygiene ages of faculty, and then we have the dental lab tech in red. You can see with the dental assisting, we have a nice bell curve. We have, you know, a fairly significant amount of younger or earlier career faculty, and, you know, still a significant amount of older career faculty. And those numbers somewhat align with the previous slide and the projections of retirements. When we look at the dental hygiene ages of faculty, we see a greater number of older faculty, 70 and above, and even in that, you know, 50 and above category, and then also a greater number in the 29 and under. So that kind of mid-career or early career faculty, the 30-year-olds to the 50-year-olds, are the smallest categories, you know, of ages of faculty in dental hygiene programs. But we have, you know, what seems to be a positive pipeline with the younger faculty, hopefully able to replace some of those anticipated retirements. When we look at the dental lab tech, we see that the higher ages, the 60 and above, and then the 70 and above, are the largest categories, and a very small pipeline, you know, with the 29 and under and the 30 to 39 age group. So we have a lot of, you know, faculty retirements coming along, and it kind of corresponds with the ages of the faculty that are in place. When we pivot over to allied dental faculty shortages, we can see this trend existing for quite a long time. We look at the number of vacant positions really over the last 10 years, and it's been on a very steady climb. And this is both the trend with full-time faculty members and with part-time faculty members. So there was some variance, you know, earlier on in the 2000s, and a nice decline in vacant positions kind of in the early 2000s, but really since about 2012, we've seen a fairly steady increase in the number of vacant positions with both full and part-time faculty. Now, when we start looking at age ranges of dental faculty, we can see that some of the trends are very similar in this category. We have dental faculty, which are aging. We see the over 70 category as a little bit smaller, but that 60 to 69 category is the very highest category that we have classified for dental faculty. So this trend also kind of is supporting that same pathway, that we're going to have a lot of faculty retirements, a lot of vacant positions existing in the dental field. This is both full-timers and part-timers. We see the pipeline, those under age 30, and then the 30 to 39, the very smallest categories. That mid-career faculty in the 40 to 59 age range are those moderate numbers. And then the largest group of faculty are really 60 to 69 in that, you know, kind of prime retirement age zone. So when we look at these next two slides, kind of have the history of dental faculty shortage. We have a little bit more data from dental faculty of where they have come from and where they go, just due to historic data that has been collected and tracked. So this slide is from 2011-2012 survey. And the next slide is 18-19, which is the most current data we have reported. They do these faculty evaluations, these faculty surveys every few years, and then it takes another bit of time for the data to be compiled and released. So we're comparing really about a decade apart with these two, from 2011 to 2018, some of these trends, and they're actually fairly similar. And what we can see is when we look at, you know, sources of new faculty, where do faculty come from who are coming to teach into dental schools? We, you know, see that, you know, a small percentage of faculty come from dental school graduation, new graduates, or graduate advanced education from residency programs or specialty programs coming, out of those academic programs into teaching. So 13% and 7% from new students, new graduates. Whereas if you look on the right, the navy blue category is the largest category, and that is from private practice. So these would be, private practice clinicians, those out there in the trenches doing patient care, who are considering a career change or a career expansion, and maybe pivoting or transitioning from private practice into the academic settings. And then the orange category is also, faculty that come from another dental school. So likely, existing academics who are, transferring institutions, moving along in their career. So on the next slide here, again, looking at the 2018 compared to the 2019 categories, we want to try to get this understanding, this perspective. We just talked about aging faculty and the number of vacant positions coming about and the number of retirements, but where does faculty come from is what we're really focusing on in these couple slides. So again, in that 2018-2019 study, we see that from those new graduates from dental school and from graduate programs or advanced residency programs, 4% and 12% respectively. So the last slide was 7 and 13%. So overall, a very small percentage of new graduates are transitioning into academia. However, we do still have a good number, the greatest number, transitioning from private practice at 48%. So those, you have to think about, why might a new graduate not be entering right into academia? And, results have shown in many studies and in many reports over the years that obviously student loan debt and the burden of student loans and, the need to get out and make some money and get, that under their belt, pay off some student loans before transitioning into academia is one thing. And obviously a lot of them want to gain experience. Teaching, has a didactic component and has, and also an experience component. And so I think many of them, need to seek that to be able to provide the education, the kind of the well-rounded perspectives that educators seek. So this is digging a little bit deeper into those numbers of, that small number of dental school graduates and residency graduates who transition into academia. Well, if they're not all transitioning straight into academia, where are they going? And, as I highlighted, most of them are going into private practice. And that's, again, what this infographic is highlighting and explaining. But, those dental school graduates are also going into residency. So, we looked at the residents and what do they do after, and many of them are going into private practice. But also we have to look at the dental school graduates, and many of them, nearly a third of them are transitioning into residency. Some of them, are transitioning into those military roles, to pay back some of the student loan debt that they may have committed to, or into federally qualified health centers, which oftentimes can provide some student loan reimbursement or repayment for those. So this is just, kind of another way to look at, where are graduates going and why may not they be going into dental education. And again, this is just highlighting that the very, very small percentage of them, less than 1%, are actually transitioning into a dental school to teach. So that's a little bit about, the ongoing, the long-term history of faculty shortages and, kind of laying the foundation of our academic presentation today and acclimating with academia. You have to understand kind of where we've been and where we're headed to, have a good foundation. And now it's kind of getting into the nitty-gritty. We're going to get into a little bit of the definitions and terms and considerations for when you are transitioning. What might it look like, or when you are entering into academia? What are some of the definitions and terms to navigate? So some of these jargons are, it's kind of like learning a whole new language within education. When we graduate, we as clinicians and as dentists and as dental hygienists and dental lab technicians, we're focused on the clinical terms or the laboratory terms and the patient care and the outcomes with that. And we learn a whole new language in that world, but education has its own language too. So really understanding kind of the broad terminology, so many times I think we've probably all spoken to students or, ourselves in our early thinkings about education, and we want to teach, we want to go teach. And we all have this vision of what teaching looks like or feels like in a classroom or in a clinic or in a laboratory. And there really is so much more to teaching than teaching. So I'm trying to help everyone understand the tripartite academic mission in academic settings. And really that involves teaching. It also involves scholarly activity or a research component and a service component. So when you think of becoming an educator, it really is all three parts of that in some capacity, and it varies from institution to institution. Additionally, when we think about titles or ranking, you hear the term college professor or teacher, and oftentimes students especially, but even academics, when you're early career, you don't have a good understanding of all the different names and types and terms and what it means to carry some of those different terms in academic institutions. So some of those are, examples are an instructor or a lecturer or an adjunct faculty member. And then you move to other levels of rankings and titles where you have an assistant, an associate, or a full professor, and then also a clinical designation. So we'll get into what the difference is between clinical track and tenure track, but in the example I have listed here, when you typically see in print or in writing or on someone's signature on an email, and you see assistant, associate, or full professor with no other description surrounding it, that typically implies that they are a tenure track faculty member. When you see the clinical designation following their title or their rank, that indicates that they are a clinical track faculty member. And we'll talk a little bit more about how the designations on those tripartite academic missions, how those designations of job equivalency and effort allocations vary depending on clinical track or tenure track. Also, you have full-time equivalent, and these definitions, again, may vary from institution to institution, but the general terms is if the positions are full-time or part-time, and then some different documents that exist in the academic world, different from clinical practice. So here are some examples of what types of activities an academic, or an educator might do under that tripartite, under the teaching aspect, under the scholarly activity aspect, under the service aspect. And I'll speak to that administration column in a moment. So with teaching, we have clinical instruction, that is, in the student clinics, generally an attending faculty member overseeing students providing direct patient care. We have didactic education, where we are in a classroom, either as a course director or as a supportive faculty member for another course director. And these could be in a live face-to-face format. This could be in an online format. This could be in a laboratory aspect. You may be a student advisor, and that could be, a mentorship type of advisor. It could be a research project advisor, a poster advisor, a student, group advisor. And then you also can be into creating or disseminating your own types of new course materials, creating videos or productions or presentations. Those all would kind of fall under the teaching aspect. When we look at scholarly activity, or when we consider scholarly activity or research, this obviously could be original lab or clinical research activities. And then depending on the institution, and again, the type of role you're in, whether tenure track or clinical track, it can also expand beyond solely original lab or clinical research to include publication of books or materials, scholarly publications, whether that be the publication of the original research, critical appraisals, white papers, literature reviews, any types of other academic writings, and then grants or funding, awards or solicitations, whether the grant be to support some of the clinical research or to support a teaching initiative or a new teaching innovation or philosophy. Any of that writing and submission and publication can all be under that realm of scholarly activity or research. When we look at considerations or opportunities in the service category, that would be intramural faculty practice, where you're perhaps providing direct patient care in your own faculty clinic. Oftentimes, this is when the academic program is housed within a dental school where they have interdisciplinary, physicians and dentists and other care providers, pathologists that have a practice where they provide care to patients. This service may be committees, whether those are college committees or division committees within your own program, or university committees, or more broadly at your academic institution. This could be professional organizations, national organizations within our, any of our professions. It could be journal reviewing or article reviewers for journals or for other types of online submission portals for scholarly publication, or editorial boards for journals or textbooks, things like that. The last column I have on here is administration. And this one isn't considered part of that direct tripartite mission, but it is another track that exists within academic schools, but also in academic professions. So it could be a dual position or a dually assigned position for someone where they're a faculty member with a designation such as associate professor, and they could also be the program director for their their program, their dental assisting program or their dental laboratory tech program. They could be a clinic director and a faculty member and have kind of dual roles where they're teaching and having an administrative component. Or they could, rise to the ranks of a dean or an assistant dean or an academic dean. And, those designations may vary. Some administrative positions, such as a dean, is perhaps 100% administrative, whereas a clinic director may be 20% for clinic director and 80% for faculty member, or some combination of that. So digging a little bit more into some of those specific terms associated with teaching, we have didactic teaching, which is typically referred to as being in the classroom, that lecture, that interactive teaching, small group work, projects, didactic delivery of foundational content, or in the laboratory setting, for example, a radiology lab or a dental materials lab, where you're learning how to do a specific skill and kind of working through the definitions and terms and procedures associated with that. Then there's clinical or preclinical learning, where they're perhaps working in a simulation lab, working on typodonts, or practicing simulated clinical experiences, or they're in clinic actually providing direct patient care to patients. For modes of instruction, obviously there's in-person instruction, kind of the most traditional. And then these ones that have, had quite a surge here in the last few years with the pandemic, these distance enhanced or fully distance learning opportunities, or hybrid opportunities. And the percentages I have on the slides are examples of how different academic institutions may assign different percentages that help a faculty member define or identify the type of course they're planning or they're delivering. Within a distance enhanced course or a fully distance course, there's some programs that are completely online, typically not our traditional entry-level dental hygiene programs, but some master's programs and some degree completion programs or other types of programs, maybe distance programs. And so that's where either, part of it is is online, maybe a small portion of it is online, whereas the majority of it is delivered online. And those sessions, that delivery of content can be synchronous content or it can be asynchronous content. So synchronous content is defined by, kind of everyone logging in or joining live to some experience or to some, dissemination of information and interacting, conversing back and forth synchronously for the content. Asynchronous is an example like what the recording I'm doing right now. So I'm recording this, and the members and the users will consume it at a later time, asynchronously, not in a live interactive session. And then hybrid is typically where there might be a larger portion of it in person, but some of it is delivered distance or online. And again, these terms might vary institution to institution of what exactly differentiates a distance enhanced course from a hybrid course. But those are some examples that perhaps 1 to 74% of it, or the majority of the course is in person, but 25% of it is online, or vice versa. So here are just some visuals that kind of can give you a little bit of perspective or understanding of what exactly those different delivery modalities might look like. So at the top, just a screenshot there of a lecture capture, just a video presentation that may be delivered asynchronously to students to watch at a later time. Sometimes it's kind of teeing up or giving a discussion or a pre-thought of a course or a presentation, and then the students watch it at a later time. Moving to the upper right, where you see kind of a picture of some teeth and some sutures and some surgical imagery there. That was an example also of an asynchronous delivery. It was a recording in an iOS application that you could draw on and annotate on to be able to visualize and explain something to students, along with video, along with audio, and along with annotation on the slides to be able to deliver that content to the students asynchronously. Moving clockwise down to the bottom right, here's an example of a live class session, students in person in the room, but also it was recorded to be able to share, for students maybe who were in quarantine or who weren't attending a session or who were out sick, who weren't there live for the session, to be able to watch it asynchronously at a later time. And then obviously, some, preclinical laboratory type of imagery there in that final image where we're live, we're in person, and students are doing a hands-on practice activity. So continuing on and expanding on those definitions of what tenure track means and what clinical track means, and some general designations of how many types of positions are typically tenure track in an academic setting. Usually less than half of the positions available in academic institutions are tenure track. Depending on the institution, they may have a designated number of tenure track positions available and clinical track positions available, and potentially even some caps on the number of those types of tracks that someone wants. For example, if a faculty member is seeking a position at a school and they would prefer a clinical track, or they would prefer a tenure track position, that school may or not be able to offer the track that the faculty member is seeking. So typically those are prescribed at an institution and advertised as such when they're seeking faculty employment opportunities. So tenure track, here we have this first bullet point. We're talking about, generally speaking, when we're talking about the tripartite mission there of research or scholarly activity, teaching, and service. That's generally kind of the order of priority that is usually associated with a tenure track position. That the heaviest or the first or the biggest category is that research or that scholarly activity category, followed closely by teaching, maybe an equivalent amount of time designated to teaching, and then the smallest category designated to service. Typically, tenure has been described as a marker of job security or a job for life. That's why someone would seek tenure at an institution or seek a tenured position. It's a staged process to achieve tenure. Typically, it's in total a 6-year process. with a 4-year review or kind of a 4-year checkpoint to see if you're progressing along the designated requirements. And then at the end of the 6th year, there's a final kind of review to determine whether tenure is granted or not granted. At that 6-year review, when the designation for tenure or the achievement for tenure is identified, typically that also, if it's granted, it also comes with a promotion. So typically from an assistant professor to an associate professor with tenure. And so that's how that process would look. And we'll expand on those requirements in an upcoming slide. When we look at a clinical track profession or a clinical track position, typically that's about 1/3 of the contracts that are available at academic institutions, remembering too that there's adjunct professor positions and clinical instructors and those other types of positions. And with this one, and when we focus on the tripartite aspect, we see that teaching is typically the first and kind of the largest category associated with a clinical track position, followed by service, and followed lastly by scholarly activity. Again, this can vary institution to institution depending on these percent effort allocations, but it might look like that, someone on a clinical track position has 70% of their time, their employment dedicated to teaching. And that could be, as we talked about before, didactic teaching, clinical teaching, laboratory teaching, any combination of any of those types of things. Maybe 20% of their time dedicated to service, and then 10% of their time and effort allocated to scholarly activity. Typically, clinical track members are on a varied contract length, typically from 1 to 5 years, could be 1, 3, 5 years, and you're reviewed for reappointment or promotion at each of those intervals, depending what your contract length is. For example, if you're hired and your initial contract is 3 years, typically you would be evaluated to be able to be reappointed as another clinical track faculty member at the end of that 3-year term. And then depending on your university's requirements, you would determine if you're eligible also to apply for promotion at that same time. So here are some examples, again, of positions, clinical instructors, lecturer, adjuncts, and then associated by generally what contracts look like for each of these types of positions, and also minimum degrees that would typically be required for each of these positions. Again, it may differ between whether it's in a university setting or a community college setting or a dental school. Some of those, have some impact on those minimum degrees that are required. But generally speaking, they're at the assistant professor and at the associate professor and at the full professor level, you could be on the clinical track or the tenure track and have a contract length varying somewhere between 3 to 5 years. They're typically longer than a year. And then also for an administrator, the contract lengths are even more widely varied than kind of that typical 1, 3, or 5-year term. And then the minimum degree requirements are typically the terminal degree in that profession for typically holding those higher level administrative roles. So when we look at ranking systems and kind of all these terms and definitions, is this widely, used between all programs? And generally speaking, within dental hygiene programs, yes, it is. And as we look at dental assisting programs and dental laboratory tech programs, there are fewer programs that use ranking systems and ranking terms to designate their faculty positions. But as a generality, dental hygiene programs, many dental assisting programs, and most dental programs within dental schools utilize these ranking systems and designations that I've been describing. So when we think of, clinical practice in dentistry, we think of a dental office and how this organizational structure of that office may look. It may have 1 to several dentists or dentist owners, a few to many dental hygienists, expanded function positions, dental assistants, utilizing many dental laboratories, that we have a general understanding of the perspective of what a dental office may look like with dentists, with clinicians, with, an office manager, front desk, scheduling coordinators, an insurance coordinator, that kind of thing. But when we look at organizational structures of academic settings, there's a wide variety. Again, depending on if we're at a community college or if we're at, a health sciences program that just has, some different health science majors, or whether it's a university setting with a dental school, or all of these different combinations. So I have 2 slides with just some examples of what it might look like, the organizational structure at some of these academic settings. And so this one is a health science division organizational chart. So this is likely a community college type of program where it just has several different health sciences, dental assisting and dental hygiene, sonography, healthcare assistants, nursing, rad tech, respiratory therapy. It has kind of all of these different allied health sciences. And you can see how, the kind of the next level would be that they report to a health sciences dean. There's likely, program directors for each of these different types of programs with faculty members under them and some administrative assistants or program advisors or academic advisors. But that's kind of the general progression or structure of these types of organizational existence for those types of programs. Here's a different example of potentially a dental school model where there is the dean, who is kind of the head of that, the highest level of that college, and the executive committee, which is likely comprised of all the various associate deans or department chairs. Again, depending on the academic institution, the different sections could be broken into departments. They could be broken into divisions. They can have different names. So in this model, you see, kind of the associate deans for kind of all of the different aspects of what happened within a dental school. We have the graduate programs, the academic affairs department, clinical affairs, the research department, admissions and student affairs, technology and innovation. Then you have the finance area, and then you kind of move on down to each of those individual sections, the department chair for diagnostics and oral health, and the department chair for comprehensive dentistry, or maybe like a restorative dentistry section. Then you have rehabilitative and reconstructive dentistry, immunology, oral surgery, kind of broken it down, that way. In this example here, you see some of the allied, the dental hygiene is in the diagnostics and oral health division. Maybe in some colleges, it's under the Department of Perio. In others, it might be a freestanding, department or division. So again, you can kind of see how, and then each of these, these have a department chair, and maybe below that for the oral medicine or for the oral path or for the dental hygiene, there's program directors for each of those. And so as a faculty member, it's helpful to understand this hierarchy in academia and this, kind of process of events within the organizational structure, and be able to kind of ascertain how it compares to, what our foundation was and what we learned in clinical practice. So understanding the types of positions and the kind of academic structure within these, now we can expand a little bit more into some of the requirements and, how you move from assistant to associate, how you achieve what you need to achieve at that 4-year interval on a tenure discussion, and do you achieve tenure at year 6? So some of these terms here will help understand how you get you move through those ranks. So the APT document is the appointments, promotion, and tenure document that is, existing for criteria and for procedures on what it takes to be promoted at your level, what it takes to achieve tenure. And your tenure initiating unit, or the TIU, is typically the department or college that your division is contained within. And so this APT document is for your tenure initiating unit. You know, obviously it may be different from some other unit across campus in psychology or in, you know, consumer affairs or something else. So your college and your department, you know, has its own tenure initiating, or excuse me, its own APT document to explain those processes for your college. So again, depending on what type of institution you're in, you may have a college-wide APT document that defines for each different component of what is required and what needs to be done. So a portfolio or a dossier is kind of how you track and monitor and report that information to determine whether or not you've met the criteria for the AP&T document, whether you're going up for promotion or reappointment. So it's the way that you kind of comprehensively collect your documents, whether it's your scholarly work and your research progress, your teaching experiences, all of the courses that you've taught, student evaluations, accomplishments, teaching awards, academic service records, anything you've created or disseminated or participated in would become part of your portfolio or your dossier. These can look different institution to institution. In some, it's a Word document, you know, that's typed in, that's filled in. Some are more, you know, robust and may include, you know, video components or, you know, recordings or different types of compilations. Again, your academic institution would have that defined of what that looks like and how it's submitted and how it's reviewed. But all of this information is used to evaluate faculty annually for those tenure evaluations, for clinical track faculty, for reappointment, for everyone, for promotion, or kind of moving through those ranks. So if you you know, are an assistant professor and you want to know how you become an associate professor, your college, your university, your institution would have an AP&T document that defines and describes those processes for you to achieve. So when we talk about those full-time equivalencies, again, these might vary a little bit institution to institution, what designates and what kind of falls into each category. But as a general rule, 100% FTE is 40 standard hours per week. 75% is 30 and 50% would be 20 standard hours per week. And then, you know, many programs don't require students to attend in the summer. So they may employ more 9-month faculty, and others do have required courses or clinical sessions where they're, you know, teaching students all summer. And so they may employ 12-month faculty. So typically at the time of your contract and hiring, you are, you know, identified and you're, you know, contracted for either those 9 months a year or 12 months a year. When we think about how we apply or how we find an academic job, the way that we apply and the way that we present ourselves is different in academia than in industry. In industry, we would, you know, submit a resume. We would, you know, do a live interview with that. You know, kind of the traditional way of applying for jobs that maybe we even did in high school. In academia, you create a curriculum vitae or a CV, and this is a little bit more in-depth than a traditional resume would be. It's, you know, kind of your historical, you know, accumulation of experiences, both professionally as a clinician in whatever your discipline is, your academic credentials and accomplishments, your professional experiences, skills, qualifications. And so this can include everything from clinical skills or clinical, you know, job duties, that expanded duties that you have met requirements for. It could be courses that you teach on a specified, you know, content area. You know, if you're a national speaker on a certain topic, you're going to have expanded information on that. If you have research publications, if you've created, you know, original works, any of those things would all be included in your curriculum vitae. So, you know, your CV eventually becomes part of your dossier, but it's typically a smaller portion expanded on, you know, all of your academic institution experiences and work that you've done in that regard. So we've talked about, how you apply and kind of how the terms look different and compare them to the structure of a dental practice in the clinical world. So now we're pivoting just a little bit to wages and kind of the comparisons of that from private practice to academia. So for dental hygiene, we can see that the national mean wage is around $78,000. Of course, this is national, and there's some wide variety. Obviously, East Coast and West Coast are in those higher categories because the cost of living is greater typically in those areas. And so you can kind of see the national mean wage for dental hygienists. When we compare those private practice salaries to an academic position in the allied health professions, we see a little bit of a discrepancy. So for this comparison, this allied dental salary that we're looking at here is, for comparison's sakes, comparing apples to apples. This is the base salary, the kind of the contracted salary that is typically found for these different allied dental health educator positions. So you can see the kind of the biggest category, the most common salaries are somewhere between $50,000 and nearly $70,000. So just straight up, if you're talking about, say, dental hygiene as compared to the last slide, the academic salaries are typically a little bit lower than what could be, achieved as a clinician, specifically in dental hygiene. I think the trends are fairly consistent across the board, where, the private practice salary is typically slightly a little bit higher than the academic salary, base salary. And so when I say base salary, what I want you to understand is that typically in an academic setting, there's other things that can be rolled into or considered as part of the overall salary. For example, benefits, health insurance, dental insurance, different types of things like that are oftentimes offered in larger academic settings. Also, there might be supplemental compensation opportunities, such as providing continuing education at your college or your program to community participants on your topic. There may be opportunities for that extramural faculty practice. If you're providing direct patient care, that could be supplemental compensation on top of your base salary. So oftentimes in academic settings, there's a larger benefit or a larger salary increase due to benefits, but then oftentimes some other supplemental income opportunities. So although the base salary may be less than the private practice clinicians, it's possible that the total salary can be more for an educator than a clinician in the allied dental professions. So when we look at for dental, we can see some similar trends. So here, this slide is looking at the private practice salaries for dentists. And you can see, a little bit of variance between general practitioners, maybe somewhere in the $190,000 range, and for specialists, somewhere up in the $300,000 range, potentially, for, private practice. And then if we move to the academic dental positions, we can see that when we look at the academic rank average for whether it's an instructor or an assistant professor or an associate or a full or potentially a department chair, that'd be in that probably that more administrative role, or at least an administrative component, we can see kind of the comparison. So for general dentistry, obviously the gap is a little bit smaller to consider transitioning to academia. If we're somewhere in that potentially that $190,000 range for a private practice dentist. As a full professor, it's not terribly far off. Again, this is just base salary comparison, not including any of that supplemental income. For an associate professor or for an assistant professor, those earlier career positions, you can see it's a larger gap between what a private practice clinician can make. And as you move up the ranks to a department chair, it's greater. And obviously this gap would be larger for those specialists. However, these academic numbers are straight base salary comparisons and not including any supplemental data. So with that, we can consider, moving into the next category here and really wrapping up our discussion on all of these topics. So the very last slide that I have here on this topic is kind of looking at existing programs of how we're funneling and how we're supporting this. We see some really exciting considerations and opportunities in education, but we know kind of the history and the challenges with those new graduates transitioning into academia. But we do have some opportunities and some pipelines and some processes in place. ADEA has several different programs that we as faculty can acclimate students to help them, understand and explore academia and perhaps have a smaller pathway or an easier pathway in that transition. Whether they actually transition right from dental school or right from, graduating their entry-level program into an academic profession, we know that doesn't happen, but laying this foundation by supporting their participation and helping them expanding their ideas and their perspectives to these different programs, we can lay that foundation to funnel them to eventually, come back in. We know that those private practice clinicians were, that's the bulk of where educators typically come from. So kind of connecting students and planting the seed to them when they're in school can help facilitate that eventual, transition. But also, so we have those programs in place. We have the faculty mentorship aspects and the faculty support and that all of that kind of ruminating and trying to generate, our future educators while they're in school. But another thought and another kind of consideration for all of us for faculty recruitment is, continue to, educate and mentor and funnel those students in. However, knowing that they oftentimes don't transition in, we need to kind of think of ways to circle back to those private practitioners who eventually transition over and make sure that we're kind of fueling and, getting those ideas and sparking that interest with those private practice clinicians. So as we are maybe exploring education or exploring how to bring others into education, depending where you are kind of in your education journey, we can kind of think of these other things. So identifying an educator mentor. Now, this could be someone who we look up to in our own academic institutions or in another institution. It could be when we're mentoring students, or it could be, one of those private practitioners, whether we challenge them to reflect back on an educator that they had, that they valued or, felt connected with, or just really learned well from. What was it about them that, that did it for them, that helped them want to learn and maybe want to become an educator? So whether you're reflecting back to someone that you have had or looking forward to someone you currently know or would want to know better, it's just thinking about that, either, planting the seed for a colleague or for a high school student or for a patient that we see or for a current student that we have, but help them be aware of educators and kind of what they might want to emulate from one of those. Another example or another thought for recruiting faculty could be just observing faculty and trying it. So again, depending where you are, whether you're thinking of teaching or whether you're trying to bring someone from private practice into academia, or you're thinking of expanding your teaching role, observing teaching is the best way to get a feel for teaching. Give it a try. Now, you may be thinking, well, how could someone give it a try? Well, especially for someone who's in that private practice sector, who may be thinking of a transition, if they hosted a study club or taught a topic, tried getting comfortable with public speaking, tried creating a presentation and disseminating it. Is that something that kind of jived with them? If you have students, are they presenting informational posters? If you have, clinical instructors who are considering transitioning to an assistant professor role. Have they kind of given it a test drive to be able to do some of these things? Also, considering those, mentors that they have identified, or, you are identifying, really dig deep into what qualities make them effective educators, and what qualities, makes you want to, emulate them, and try to seek some professional development opportunities in some of those various areas. Lastly, if you're considering a career in academia or wanting to advance your career in academia, we have to, kind of meet students where they are. And we have wonderfully smart, wonderfully diverse students from all over the world attending our programs. And we need to learn about them. And we need to learn about how we are different at our ages and our cultures, and how we can, close the gap between where we are and where students are, to make better connections for academics and for learning. So those are some considerations when we think about faculty recruitment and retirements and, jargon within academia, how we can try to, be able to really completely wrap our head around the consideration of transitioning to academia, expanding or growing in academia, and closing the gap on those faculty shortages that we have had historically. So, no matter where you are in your academic journey, I really hope this presentation was able to potentially clarify questions for you, fill in a knowledge gap, inspire learning, or potentially be a catalyst for mentorship and faculty recruitment to enhance the future of dental and allied dental education. Thank you for joining me today.